half the veterans I talk to who are actively using cannabis are without card.
Arizona just passed a bill allowing veterans who suffer from PTSD to get medicinal marijuana. However, Dr. Sue Sisley says vets aren't signing up.
They don't want to be on a list. They don't want to be tracked by the government. Then you have to go to a dispensary where the marijuana is probably twice as much as it costs them on the black market.
Ricardo Pareda is one of the many vets coming out of the cannabis closet to pressure the government to recognize pot as a legitimate treatment for the wounds of war.
Having discussed this issue with friends of mine who were going through similar issues and symptoms and whatnot, finding out that they were using cannabis almost exclusively, and it was working for them. They were able to show up with their families. They were able to show up for life.
The federal government classifies marijuana as a Schedule I drug, the same as heroin and LSD. That means the Veterans Health Administration, which runs the largest networks of hospitals and health clinics in the entire country, cannot prescribe pot as a treatment, even in states where medicinal marijuana is legal.
And then they'll find THC in your system, and all of a sudden you find yourself out of, medication because they won't fill your opiate prescriptions anymore. It's unjust.
Marijuana advocates say that it is urgent that the government recognizes cannabis as a legitimate treatment because there are so many vets desperate for help.
The drugs that I prescribe to patients every day are riddled with side effects, and my impression at this point of marijuana is it seems to have a remarkably low side effect profile.
To continue to say that cannabis is an alternative treatment, or that these plant-based medications are alternative treatments. Number one, cannabis isn't a drug. Xanax is a drug. Cannabis is a plant.